The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host Kimberly Brummel, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you on the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' miraculous recovery stories. Today, we'll have a Skype interview with Mike Cayley, Senior Vice President of Lockton Dunning Benefits, to hopefully answer some of the questions you have concerning the Unaffordable Health Care Act, better known as Obamacare. We'll also hear from our Help from Wounded Warriors patients that have received complimentary and exclusive Bonati spine procedures from world-renowned surgeon and founder of the Bonati Spine Institute, Dr. Alfred Bonati. We will hear about the remarkable recovery from them personally and the medical staff that assist Dr. Bonati in treating these patients in our Back to Life segment. We are also very fortunate to have Florida Congressman David Jolly join us at the News Radio 970 WFLA studios for simulcast of this TV program and our radio program, American Medicine Today, which can be heard Saturdays at noon. Congressman Jolly is very concerned about the crisis facing our veterans and the problems in their medical care. Finally, we'll hear from Dr. Bonati about how he feels our government needs to react to the inadequate care facing our veterans and what we all can do to help our wounded warriors. Joining us back from New York City and introducing our first guest is our radio and TV program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thank you, Kimberly. Pleasure to be back. Now, every Saturday at noon, we typically feature a guest that'll shed light on the growing concerns many Americans have about their medical care. The Unaffordable Health Care Act, or Obamacare, as we like to call it, is something we take head on, but not with any political agenda. We just want to bring light to this crisis in American medicine today.
Mike Cayley is the Senior Vice President of Lockton Dunning Benefits, the world's largest privately owned insurance brokerage firm.
Mike has extensive knowledge of the Affordable Health Care Act and can hopefully answer some of your questions.
What are some of the inadequacies that you see currently with Obamacare?
Well, thanks for having me on today. I think there are several things that are inadequacies built within the program. The first of which is that it may not be affordable for anybody at all. When you look at the changes that have happened to the private marketplace and the inadequacies of the public health exchange rollout, it hasn't seemed to work well for anyone. And the way that it's structured really increases the cost for everyone. There's nothing, as a matter of fact, very limited things have been done to actually control any of the costs associated with healthcare.
Very true. And I'm not sure that it's still even reaching the people that needed it. I think they've taken from the people that had insurance and then they put them in the pile now for Obamacare, but I don't think they've reached out to that group that they said they were making Obamacare for.
Certainly, we've spent a lot of money as a country creating additional 8 million people on the public exchange, which seems like a whole lot of resources expended for very little resource or result. And what happens here is that by expanding Medicaid, we've transitioned a lot of additional folks into that system, which creates liabilities for the states. And from an individual perspective, we haven't lowered the cost of health care. We've simply said, for those that are making less than 400% of the poverty level, that we're, as a federal government, going to pay a portion of your premium for you. So we've created a disjoint between who's actually using the service and who's paying the cost.
Correct. And the subsidies get passed on to the rest of the citizens, do they not?
Subsidies get passed on for people that don't have an offer of qualifying or affordable coverage from their employer.
Okay.
And make below 400% of the poverty level. And so there have been a lot of reports recently that upwards of 3 million people may be receiving subsidies incorrectly because the federal government can't actually verify their citizenship, their immigration status, or the income requirements necessary to receive the subsidies they're already getting.
I don't know if you have access to this, but have you seen an influx of Medicaid recipients?
Absolutely. The Medicaid rolls have expanded tremendously in places like Texas or Florida, as an example. You haven't seen an extension of Medicaid, and so those rolls have not expanded, but traditional blue states, Illinois, California, Washington, Oregon, Vermont, New Hampshire, places like that, where they have extended Medicaid, that's where a large percentage of the newly covered individuals have actually found their home.
Right. Have you seen companies' insurance being canceled because of the new legislation that's built into Obamacare?
We modeled health insurance expenses under health reform for about 700 employers over the last 3 years, particularly in retail, hospitality, restaurants that have a significant impact as it relates to health reform. And almost all the time, it's the wrong decision to do away with health insurance altogether. It will be the most expensive way for these folks to do it.
Right.
And it ignores the fact that we need quality employees and we want to treat our employees well as a way to deliver the right service to the right people. American industry falls apart. So I think employers are trying to find the right balance between being fiscally responsible and the general paternalistic view that most take.
Do you feel that Obamacare is going to affect the quality of care that they should be receiving?
I don't think you have to look very far relative to recent news events to determine how government applies health care. You looked at the VA, you looked at Medicaid or Medicare in some cases, and the types of efficiencies that they might interject into the system. I think ultimately what it comes down to is having a comfortable relationship with a physician, having access to the means to be able to pay for that reasonable and quality consultation, and the mechanism we use in order to generate that is what will help us to solve this healthcare crisis in America. We don't necessarily, in my opinion, need the government to tell us exactly what we need to cover, how we need to do it, when we need to accomplish it, and penalize us for private purchasing decisions.
Okay, well, thank you very much for your time. We certainly appreciate you being here. I'm Mike Cahey. Thank you.
Thanks a lot.
Please join us on News Radio 970 WFLA Saturdays at noon to hear more from Mike Cayley and other politicians and experts about the crisis in American medicine today. Now, Kimberly, some of our viewers have inquired about why Dr. Bonati chooses to air his political opinion in a public forum.
Well, Dr. Bonati believes it's his duty to help protect and preserve the medical rights we have in this country. Please understand, Dr. Bonati is first and foremost a highly skilled surgeon that is truly passionate about helping his patients that have suffered or are currently suffering with back, neck, and sciatic pain for many years.
We'll be right back to hear from a Bonati spine procedure recipient benefiting from our charitable Help for Wounded Warriors program and our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows a surgeon more access to their patients and allows you to go home the same day. Dr. Bonati is proud to call himself an American, but he is very critical about the crisis in American medicine today. He vehemently disagrees with Obamacare and wants to help our veterans receive the medical care that they deserve. Dr. Bonati and the staff of the Bonati Spine Institute are proud to assist some of our wounded warriors by providing surgical procedures at no charge. Here's just one of our Help for Wounded Warriors Back to Life stories.
Actually, right now, with my neck involvement, I'm really not able to do much of anything. My arms are involved and they feel numb and kind of useless.
She was a major on the Air Force, and she was in charge of a large amount of nurses in Vietnam. She was injured during that time, and she never recovered from those injuries. She was in a situation of a lot of pain and without being treated. So she came to us for the program that we have for Wounded Warriors.
I had gone to another spine institute in Tampa, and that was before I heard of Bonati. And I was just so pleased to know that somebody could help me.
When a person first comes in, they've been through a long process. I always say that I'm glad you were able to find your way to us. And sometimes the path is a long one because they go through a lot of different types of procedures before they find us.
I never thought it was going to happen. I went to everybody. I saw a spinal surgeon. I went to the laser people. I've been everywhere, and nobody wanted to touch me.
It's always exciting to see the response of our patients, to be a part of that experience. It's I'm just there to help and make the process easier for them, but Dr. Bonati makes the magic.
We found that she has several problems on the cervical spine, that they were the major area where she had was crippling her. The major area where she had most of the pain is already resolved.
Thank you, Dr. Bonati.
Good?
Oh, it feels better already.
It feels terrific to help the Wounded Warrior veterans. This is a group that has proven themselves. They're most worthy of extra effort on our part.
You know, I haven't been able to do this for over 3 months.
Pick something up. Is that easy?
Just to pick something up with your thumb and forefinger, or to have enough strength to open a Coke can.
It's nice. It's one of the reasons why I look forward to coming to work. She will get the best result from surgery that she possibly can. She's motivated, she's smart, and like a lot of vets.
This is the first time that I am paying free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
It definitely works. And I really don't know what else to tell you. I'm happy.
When we return for our final segment, we'll be joined by Florida Congressman David Jolly in the News Radio 970 WFLA studios to discuss his concerns about the crisis facing our veterans and the problems in their medical care.
And finally, we'll hear from Dr. Bonati about how he feels our government needs to react to the inadequate care facing veterans and what we all can do to help.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to our final segment of American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Thank you for joining us for American Medicine Today. I'm Kimberly Bermel, joined by Ethan Euchre. And yes, I said Ethan Euchre.
Yes.
We brought him back from the blaze.
I am back from the dead.
Yes.
And we are so proud to have you here.
Did my time in Manhattan, decided it wasn't for me. And thank God for you, Kimberly, and Dr. Bonati for bringing me back. So here we are.
Absolutely. And we have Jeff Wagstaff here, our senior fellow.
He is. You're still a senior fellow, I see.
I have remained a senior fellow here at the Bonati Spine Institute.
Very nice. Very nice.
And we have world-renowned orthopedic surgeon, Dr. Bonati. And in studio, we have guest Congressman David Jolly. Thank you for being here.
Thank you, Kimberly. I appreciate it.
We are excited to speak to you not only about the debacle with the VA, but also about your thoughts on Obamacare.
Sure. Which one do you want to start with?
Well, I mean, the first thing, kind of why I reached out to your folks, Congressman Jolly, is Kimberly wanted to get somebody to talk about the VA scandal, and I see you all over the news up in Washington talking to some of the whistleblowers and this and that. So just if you could give us a little bit of background on how you got involved, and for people that don't even know what the VA scandal is all about, if you could kind of summarize that as well, that'd be great.
Sure, of course, you bet. So when a new member of Congress is elected, they're assigned certain committees of jurisdiction. I asked to go on the Veterans Affairs Committee. This was about 3 to 4 weeks before this crisis broke.
Oh, wow.
So it was very interesting timing to go onto the committee. We know that the density of veterans in the Tampa Bay area and Pinellas County, where I represent. We know the good work at Haley and at Bay Pines. But the fact is, VA is going through a crisis right now. And in the words of one of their senior leaders, it's a crisis of integrity. And we can't lose sight of the fact that veterans have died as a result of negligence of the VA. And that's not to be political. Those are the facts. Veterans have died. It's a historic crisis. We should recognize it as a historic crisis, and I think it needs historic solutions. My concern is the political establishment is always too late to identify a crisis and too quick to consider it resolved. We are nowhere near having this resolved. So what are a couple things that have happened already? The immediate need is to clear the waiting list. The tens of thousands, maybe 90,000 people on the waiting list. Wow. The administration is working through that proactively. Congress is trying to give them additional authority to move through that waiting list even more quickly. And then how do we pay for it? There's a bill pending in Congress that hopefully will be resolved very soon that freezes senior level bonuses for the next 2 years. And that in itself frees up $800 million that can go towards health care.
The $800 million that were just being given out in bonuses.
That's right. Here's an interesting thing about one of our hearings. You'll like this. So,
how do you get that gig? That's what I want.
Well, it gets even better. Okay, so bonuses are based on evaluations at the end of the year. Of all the senior officials that were reviewed, not a single senior VA official received an evaluation of less than above average. Now, explain how that works on a bell curve. If everybody's above average,
right,
then who are you being compared to? There's no average, right? So $800 million will be saved when this law is enacted.
When we know the entire system is operating well below average in competency and efficiencies.
That's exactly right. Listen, we could talk about several reforms. I have a few ideas. I will tell you this. A number of veterans, the vast majority of veterans that I speak to, and we recently had a day where we invited every veteran that wanted to come speak to us, come into the office. We had about 300 people show up. The vast majority want to stay within the VA healthcare system. They like it. They like their doctors, they like their nurses, they like their staff. There obviously are those who want to go outside of the system and have complaints. So I don't necessarily subscribe to the notion of just voucher everybody out and shut down the VA because the veterans like it there. Here's something I think we can do, though, to inject the competition that will ultimately lead to improvements in VA healthcare. Give every veteran a choice card, like a TRICARE card, like a Medicare card. Let them choose where they want to go. If they want to go to the VA, go to the VA. If they want to go to another provider, go to another provider. And what we will be able to quickly identify is what is the attrition rate of patients at different VA facilities. Because it'll be different in Tampa and St. Pete than it is in Arizona or Boston or LA. But we'll be able to identify based on competitive pressures which hospitals are performing well.
Congressman Jolly, you've had a chance to really drill down on this. What is the state of those VA facilities here that our Tampa Bay area veterans, when they go to the VA, what kind of service are they receiving? I think we can all agree that they deserve the very best of health care. But what are they actually receiving? All we hear are the negatives on the news. But what is your personal assessment of these local facilities?
We hear great compliments about the doctors and nurses and staff, about the quality of care. We really do. We hear great compliments about the quality of care. The frustration is, first, in getting in. It can be months to get your first appointment. So the delay in getting in. Secondly, if a patient, a veteran patient, asks for a different physician or asks to go outside of the system, they rate that experience very poor. One of the things we did when we had the 300 people in our office is we did a survey. Now, this is a self-selected group, but roughly 70% rated their care as excellent. If you go average to excellent, it got up to about 90%. But for those who said they asked to go outside of the VA healthcare system, the process within the VA to get referred out was rated as very poor by about 50% of the patients. So quality of care is great if you can get in and get it. Referrals are not operating as efficiently or as patient-centered as they should. And then lastly, in specialties and subspecialties is where we hear a number of complaints. One of the greatest concerns we hear is the length of time for a specialty consultation. So, for instance, a colonoscopy or some type of gastroenterology. And the wait list then, that ultimately when the patient is seen 5 months later, 8 months later, 11 months later, we've heard a number of cases where they're then diagnosed with stage 3 or stage 4 cancer when they should have been in to see that physician 11 months earlier, 5 months earlier, whatever the time wait is.
Well, we got about 2 minutes left. I know, Kimberly, you wanted to get Congressman Jolly's thoughts on the Affordable Health Care Act. Don't really have a specific question for you other than, one thing that keeps coming up every time we discuss it is sort of the constitutionality of it.
Sure.
You're an attorney. I mean, is the Affordable Health Care Act constitutional?
I think the individual mandate is unconstitutional, personally. The Supreme Court has ruled under the taxing authority of the Congress it can be declared constitutional. That, to me, suggests it's the largest tax increase in American history then. Listen, I would have voted against it. I would vote for repeal of it. But we have to have answers as well on my side of the aisle. I like to talk about a term health insurance plan that provides price certainty, can't be canceled based on intervening health events. That, or a term health insurance plan, that's accomplished through less regulation, less government. Decouple it from the employer. Listen, we wouldn't have the Hobby Lobby case right now if people actually had control over their health care and didn't have to rely on an employer-subsidized health plan. That is one more example of what happens when we have regulations and too much government controlling our health care.
How affordable do you think the Affordable Health Care Act has been?
Well, if you ask people in Pinellas County, not very. And you ask those who have lost their plans, not great. There was a story this weekend, actually, somebody who was excited to get an affordable plan, and it turns out they can't actually get a doctor now because the Humana plan that they chose, their doctors aren't available. So listen, Obamacare has been a disaster. It is the president's signature signature legislative achievement. And yet on his own, he's unilaterally delaying and postponing provisions of his own signature law.
Correct.
And that reflects the fact that he knows it's a disaster.
And how come so many companies are becoming exempt from it?
Well, that's a result of his 1 year delay. So, Congress continues to push through changes to Obamacare, and he won't even listen. But yet, on a Friday night, late at night, he'll issue an executive order to actually delay or change his own law because he knows what Congress has been saying, and frankly, what the American people have been saying is right all along. We could have accomplished specific solutions to our healthcare issues, healthcare coverage issues, without bringing the government in to 1/6 or 1/7 of our economy. The patients have lost choice. They've lost control of their own health care. It's driving up costs. And where we're really hearing concerns is from businesses who have rushed to renew plans ahead of the Obamacare requirements, or who are having to absorb additional costs, or frankly, lay people off or reduce their hours to comply with Obamacare.
I think because nobody really read it and knew what was in it.
That's right.
That was the biggest problem.
Yep.
That's right.
All right. Well, we appreciate your time, Congressman David Jolly. Headed back to D.C., I'm assuming?
Tomorrow morning, we'll be in for 2 more weeks, and then we'll be working here in the district over the month of August.
All right. Well, it was a pleasure. Appreciate you stopping by the studio here and joining us on
much.
American Medicine Today. So thank you very much.
Thank you very much. I appreciate it.
Thank you. Well, Dr. Bonati, I know you're all wound up about the VA and, of course, Obamacare, so why don't you take it from there?
Well, we keep talking about the Obamacare, we keep talking about the VA scandal. Problem is, both are practically entangled with the politicians. So the results are going to be nil and probably would never solve this trouble. Let me tell you this. Just to correct a little bit, to put a patch on the VA problem, we need around $17.6 billion. That is going to bring 1,500 more physicians and 8,500 more nurses. But guess what? They're going to be under the rules of the contract of the government. So you're going to hire people that they are going to be, again, in a irresponsible behavior. You cannot hire people that you cannot fire if the results are not good. Now, if you look a little bit more, the amount of responsibility that the VA has is unparalleled in business. One of the problems that we see is this scandal that you have on the manipulation of the waiting list will never happen if the physicians will be managing this, or a reputable structure of business will be managing this. The next thing that happens is you see they are an overpay of all the individuals that work in the VA. But guess what? They are not physicians overpay. They are clerks, they are managers, and the last year they have $800 million on bonuses. So imagine the amount of help that the vets can have with that amount being spent in irresponsible, totally incompetent, mismanagement, and individuals that they don't have the heart to help our veterans.
Thank you for watching American Medicine Today. If you have any comments or questions, please feel free to contact us at the number below or tweet at Dr. Bonati or hashtag American Medicine Today. We respect your views and opinions and would like to hear from you.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The preceding program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.